Dr. Heller, who is our ER physician here at St. Mary's. We also have Alan Miller, who is the CEO of Cope Health Solutions. So I'd like to give a warm welcome to Dr. Heller and Alan Miller.
I always wanted to be the kind of doctor that could deliver a baby or take care of someone with a heart attack or sew up a laceration. I like the idea of knowing everything about the body and about what was wrong with people, like in ER, but I encourage you, if you haven't been there yet, when you come, if you see me there, please come up and introduce yourself so that I can make sure you get to see some things and we can talk about any questions you have or your plans for the future.
And actually, Cope Health Solutions grew out of that time period when I was at Santa Monica Hospital. So we created the Care Extender program, which is now over at UCLA, and which we've now expanded to be clinical care extenders all over Southern California, and if you haven't heard, now in Seattle. And then we also took basically some experiences I and others had at Santa Monica Hospital and Venice County Clinic, working with homeless kids, and we decided to train a bunch of students like you every year to go out to homeless shelters and mentor homeless kids, and that became community outreach for prevention and education. And that's really what transformed our company from a program that did mostly homeless outreach and started our pipeline into a company that really has two main core purposes of our mission, which is really to transform healthcare. Number one is we want to transform delivery, make it more rational, make it make sense, and part of that is really transforming the financial incentives, because at the end of the day, people do what you pay them to do. So if you're not paying them to do the right things, they will do the wrong things, and care will be more expensive and more frustrating. And the other is to build the workforce needed to really serve people in the new healthcare paradigm, and that's hopefully all of you. So healthcare is changing. You know, the roles of physicians are changing, and really what our company does outside of the work you know, which is our pipeline, is we really sit down with doctors and hospitals and government leaders and payers, and we help them to start thinking about how they're spending their money and how they can change the way they spend their money to support their physicians, their nurses, their other clinicians, their administrators, to really provide better, more accessible care.
I took a lot of courses in the humanities and the arts, and I also then got a major in theater arts. I did a lot of acting and the like, and I think having that well-rounded background, studying more than just science, knowing a little bit about culture, history, social studies, was the best thing I could have possibly done to prepare me to be a physician. You can all learn the science, but it's the other, it's the relating to people, it's knowing about culture and sociology that really helps to make you a well-rounded physician. So,
but study hard. Learn how to study now. That's one of the big messages I give to folks. I do a lot of counseling for our clinical care center and other folks about where you want to go in the future. And the question always arises, hey, I want to go to the best MBA program, I want to go to medical school, or I want to go to UCLA something or other, or Stanford, whatever. And my first question always is, what are your grades? And a lot of times the answer is, well, And so what I would ask you guys to do is leverage this program to get you motivated and excited, but study hard. That's the one big thing I wish I had done in my first 2 years at UCLA, is started right away with a good study habit and getting top grades.
I guess the advice is really to pay attention. And by that I mean make sure that you are always in the moment. Even when bad things are happening, pay attention to them so that when you look back, you won't say, boy, I wish that I had paid more attention and I didn't let the time go by without thinking about it. Make sure that you let all of your prejudices or the human impulse is to judge. And if you begin judging people, particularly in the emergency department, you will inevitably fail or you will burn out, one or the other. You just have to go in with a clean slate for everybody you see. You have to treat them as if it's one of your families. Pick out the people who you see as doctors that you want to model yourself after.
The vision was to connect people who want to learn with experiences that they would never get anywhere else. And that's kind of the vision. Where that's gone, I'll tell you guys what I'm really excited about, if you haven't heard, is that we're most likely going to get school credit for folks coming through the program. So the idea is, it's always been an educational internship. We're now trying to formalize that.
And to have you folks there, you're enthusiastic, you're smiling, you help to put patients and their families at ease, and you make such a difference by being there that you really, I think, help not only patient satisfaction, but I think that positive attitude helps people to be more optimistic, and I think that helps healing.
Is across the country, there are some big things this law has done. Number one, it's increased coverage. So if you are up to 26 years old now, your parents can keep you on their insurance. Number two is if you have what's called a pre-existing condition. So if you're sick and you go to apply for a health plan, they can't turn you down just because you have that pre-existing condition. That was previously pretty common, and in fact, sometimes health plans would cut you off their rolls when they found out you're sick. And it was hard for the states and the feds to regulate that. So you're more likely to be able to have care under those two. The other thing they did is that they expanded what's called Medicaid.
We spend more money than any other country, and yet our results are not very good in terms of infant mortality and age of death, et cetera, et cetera. So we're not spending that money wisely. And in my vision, a universal health care, a single payer plan, sort of a Medicare for everybody would be the best way that we could handle the health care reform, if you will, in this country.
I just want to, again, I know we have to get going, so I personally want to thank you all, not just for having us and me here, but I mean, I want to thank you for your commitment to St. Mary Medical Center and to the patients. As Dr. Heller said, you know, this makes such a big difference to the patients. Everything you do, I mean, we train you to make sure you're safe so you don't hurt people. That is obviously #1 priority. And then you go beyond that and you sit with someone who's 87 years old, who doesn't have a family to come visit them, who just needs to tell someone a story, who needs to be able to explain how they feel about the meal they just had, or who needs to ask for help from the nurse but can't get to the call light. And you guys are able to bridge that gap, help them feel more human, improve their experience during one of the worst times of their life. I don't think very many people will tell you that unless they had a baby and it went well, being in a hospital is generally the worst time in people's lives. And so you're there for them. So I want to thank you. I hope you recognize the honor you have to be able to do this. And I also hope you recognize how thankful the hospital and the patients are to have you here. So thank you so much.